If we don't pay better attention to it, we're going to hear more and more sad stories about communities losing their health system.
In other words, access to rural hospitals cannot be cut. Data shows doctors at these medical centers see the more sick and poor patients than urban hospitals. And this evening, 25% of rural hospitals across this country are at risk of closing their doors to patients by 2023.
Hospitals are admitting an influx of patients. Staffing and funding shortages are making that a challenge. Fox 8's Daniel Pierce is live at Randolph Health, where hospital leadership recently dealt with the threat of having to close.
There were times that everyone thought that these doors would be closed for good, but a last-second merger between Randolph Health and American Healthcare System prevented that. And since the hospital has been on the rebound, something more than 450 rural hospitals in the country need to do, and they need to do it fast.
It is sad what is happening to rural health. They are a backbone of this community.
Once that backbone breaks, rural communities will fall apart.
Healthcare systems have failed. You see those communities usually start to decline.
In a 2020 report, the Chartis Center, which works with rural hospitals, found 453 rural facilities on the brink of closing, mainly because of finances. The federal dollars they received these past 2 years to fight COVID only delayed that.
Urban centers see some of these same things too. They just have a bigger capacity. They can absorb more than we can.
April Thornton is with Randolph Health, one of the dozens of rural hospitals in the state. Since its merger with American Healthcare System in 2021, the facility has been able to hire more staff and expand the care it provides.
It's 140,000 people in this community, and we are the only hospital. The closest hospital would be about 35 minutes. If you are in a life and death situation, 35 minutes is not good. Doctors and nurses at rural hospitals treat patients struggling with mental health, overdose, or heart disease at a rate higher than the state average. And Randolph Health, roughly 15% of those patients are uninsured. That's a trend everywhere. I think it's a lack of reimbursement. So when you have a poorer, sicker population that doesn't have insurance, it's hard to collect.
Since 2010, 7 rural hospitals have closed in North Carolina. 2 were in the Triad. Between 26 and 30% of the remaining rural centers are at risk of following in their footsteps. If that happens, the ripple effects in the community could be endless.
Not only do you lose health care, you lose probably one of your largest employers, you lose that tax base. How are you going to recruit new business or industry to come? And so there's a huge ripple.
And we still do not know which of those hospitals are considered to be in that 26 to 30% range that we were talking about there. The State Department of Health and Human Services does have a rural hospital program. It is giving $4 million out to hospitals with rural hospitals with fewer than 49 beds. So far, it has been able to help 23 rural counties and 31 hospitals. Live in Randolph County, Daniel Pierce, Fox 8 News.
All right.